All right, good afternoon, everyone, and welcome to the Afternoon Bell. Happy Monday, even though it's a little bit dreary out there. My name is Ellen Desmond, and I work in the Bureau of Student Wellness at the New Hampshire Department of Education. Our team has been coming to you live for Afternoon Bell live stream sessions on Mondays, Tuesdays, Thursdays, and Fridays at 3 p.m. And it's really just our opportunity to discuss issues with folks in our community partners, folks in the field, and provide some supports to New Hampshire educators, to some families, and to students as New Hampshire learns remotely. You can find all of our live broadcasts as well as previously recorded sessions on our YouTube channel, which is NH Student Wellness. And we encourage you to follow us on Twitter at NH Schools and on Facebook at NH Student Wellness, where you can find all of our morning coffee chats as well, weekdays at 9 a.m. and a wealth of other resources. And the department is also updating our remote learning website, which is nhlearnsremotely.com. So check that out for more info about remote instruction and supports. As always, please feel free to share questions and comments in the chat box during this live stream or after, if you happen to be watching this live stream retroactively. We'll make sure that we connect all of our presenters to you if you have questions, comments, thoughts, either during the presentation or offline. Our session today is AFSP 101, Helping to Create a World Without Suicide. The American Foundation for Suicide Prevention is a national organization dedicated to saving lives and bringing hope to those affected by suicide. AFSP creates a culture that's smart about mental health through education and community programming, develops suicide prevention through research and advocacy, and provides support for those affected by suicide. Today, Shamra Simpson, who is the AFSP Area Director, and Lisa Riley, who is the New Hampshire Chapter Chair, as well as a member of AFSP's Chapter Leadership Council and National Board. They are both here to share about this leading nonprofit organization and how you can join in the fight to stop suicide. So Shamra and Lisa, welcome, and I'm going to turn the presentation over to you now.
Thank you.
Good afternoon. Thank you so much for having us. Lisa and I are so thrilled to be able to be a part of this program today and for the next 4 Mondays. So I hope you're all excited to every week. Today, we just want to share a little bit of information about our organization, who we are, why we are doing the work that we're doing in the country and specifically in New Hampshire, maybe a little bit about how you can get involved in our efforts, and kind of share with you what our plan is to some of the topics we plan to share for the next couple of weeks. And with that, I'm going to get started first, and then I'll hand it over to Lisa in just a little bit. Our mission at AFSP is to save lives and bring hope to those affected by suicide. We work every day nationally and in the field right here in New Hampshire with survivors, those who have personal struggles, and anybody that we can to save lives and bring that hope to everyone. Our organization was founded in 1987 by a group of individuals, researchers, and families who had lost loved ones to suicide, who really wanted to take action against this leading cause of death. They felt that coming together and raising some funds and supporting advocacy efforts and creating smart legislation that addressed mental health and suicide prevention would make a difference and reduce the rate of suicide in our country. Now we have a nationwide movement over 1 million people around the world and a chapter in every single state in our country. Our core values center around passion, community, harmony, impact, and well-being. And this is a core value for us that is disseminated to our organization every day from the top down. Our CEO, our vice presidents, in our leadership team, we get messagings around these core values every single day. These are important to us, and we try to bring them out into the field as well. We are an amazing organization doing a lot of work around suicide prevention and supporting those who have lost somebody to suicide. But there are a few things that we are not, and it's important to recognize that we are not a crisis center. So if anybody is struggling and reaches out to our organization, whether it's a staff person, a volunteer, a board member, we do not handle those crisis calls, but rather will refer those individuals to the National Crisis Hotline or to a statewide hotline. We also do not run our own support groups, and the chapter is not a support group. We do support individuals in their journey through hope and healing. So we will use chapter funds to sponsor individuals to become trained to be a support group facilitator, but then we do not run those support groups. We'll provide resources, brochures, and of course, invite anybody to our events, but we don't run those support groups. And then we also do not make grants to other organizations. We do raise funds in our chapters so that we can invest them directly back into our communities. And we will help with events. We will offer free programming, free resources, host conferences, either educational conferences or advocacy type events, but we do not use our funds to grant other organizations. We feel very strongly about partnership to create a world that's smart about suicide prevention, smart about mental health, and really drive our efforts forward. We know that even as the largest nonprofit with a focus on suicide prevention in the world, we can't do this work alone. So you'll see on the screen now a large number of organizations that we partner with to drive our efforts forward. You'll see NAMI on there, who runs support groups, and so we'll refer folks to them. We work with Zero Suicide, the Mighty, the Trevor Project. A lot of our ad campaigns and other books and materials will include our logo as well as our partner organizations. And so we not only partner with organizations, but individuals in our state and anybody we can to do the best work that we can and reach as many people to talk about suicide prevention. Now I'd like to just talk a little bit about why we fight for this cause. Why is suicide prevention and mental health awareness so important to us? According to a recent AFSP sponsored Harris poll, we found that 94% of Americans think that suicide is preventable. That means most Americans actually stand with us and believe that there is something that we as individuals can do to help prevent suicide. And that tells us that we've got a really strong reason to get out there and have our voices heard and fight suicide right now. We also found in this poll that 94% of Americans would do something to help if someone close to them was thinking about suicide. So now we have a large group of people who believe that suicide is preventable and want to do something to help if somebody is struggling. So we know that we've got to get out there and provide the tools, the resources, the education, the funding for resources, the funding for research, everything we can to address this leading cause of death. In the United States, about 48,000 people die each year from suicide. It is the 10th leading cause of death in our country and the only leading cause of death in the top 10 where the rate continues to increase each year. Suicide is the second leading cause of death for our youth. So we're talking our kids ages 10 to 34 years old. The second leading cause of death, that is a staggering number that tells us we've got to fight for change. Suicide deaths and attempts cost the United States economy about $69 billion a year. And that's from work loss, medical expenses, loss of productivity in the workplace. But $69 billion is a large number that we've got to try to reduce as well. And it is estimated that for every single person that we lose by suicide, another 25 people will make an attempt. It's about 1 million people every year just in the United States who attempt suicide and survive. We've got to fight for those individuals and continue to fight to support those who have lost somebody. Nationally, you can see the suicide rates across the country. You'll see up in our region in New Hampshire, we have one of the higher rates of suicide. New Hampshire actually has the 10th highest rate of suicide in the country right now. But we're surrounded by states who have very low numbers, Massachusetts, Rhode Island, and New York. Their suicide rates are very low, and we can learn from them and work with them to implement efforts in our state to offer public health resources to get our numbers down as well. Here's how we're fighting. So those statistics and information tell us why we're fighting, and here's how we're doing it. AFSP is the largest private funder of suicide prevention research in the world. We raise money in our states and in our chapters, and we keep some of the money for our chapters to invest locally. And then we give some of the money that we raise to our national office so that we can invest in research, so that we can better understand mental health conditions, the way that we're treating them, the way that we're intervening with somebody who's struggling, different medications. But the more we learn about mental health and support, the better job we can do of reducing this rate of death. We also fight for suicide by raising awareness and funds in our communities through our Out of the Darkness walks. We have a community walks in the fall, campus walks on high school and college campuses in the spring, and every June we host Out of the Darkness walks where you walk 16 miles overnight and you finish the walk in the morning as the sun rises, bringing our mission out of the darkness and raising awareness for mental health and suicide prevention. We also, as a nonprofit organization, offer loss and healing programs. We are primarily a prevention organization, but we do appreciate the importance that postvention has on prevention. So every Saturday before Thanksgiving, we host an International Survivors of Suicide Loss Day. This is where we bring individuals who have lost somebody to suicide to come together in a room together to share their journey of hope and healing and move forward in their grieving process. We also offer a Healing Conversations program where somebody who's recently lost somebody to suicide can reach out to us and have a conversation with somebody who is a little further along in their healing journey, but has experienced a similar loss so that they can get that hope, healing, and support from somebody who's been in their shoes. We also offer prevention education, and this is really important to our school communities right now. We have 3 programs right now that we are offering virtually when we're kind of in this new world that we're living in. The first program is our Talk Saves Lives program. Again, this can be offered virtually, and it's an introduction to suicide prevention. The program covers the scope of suicide, factors that increase a person's risk, warning signs to look out for, how to have a conversation and intervene with somebody who may be struggling or may be having thoughts of suicide, and how to get them the help that they need in that crisis. We also have a college film that's perfect for high school students and especially freshmen and sophomores in college. The film follows 5 students in their transition from high school to college and recognizing within themselves when they may be struggling with their mental health, with anxiety or depression, and then how to seek help and get treatment on their own when they're away from their parents and families. And then our More Than Sad program is a teen depression program. And this is a program that follows 4 students with different presentations of anxiety or depression, different intervention techniques, and different ways to access help and support those students who may be struggling. The presentation is offered in 3 different ways. It can be presented in 45 minutes to students, and about an hour and a half to 2 hours to parents, and then about 2 to 2.5 hours for educators. And again, this meets the requirements for the Senate Bill 282 that was passed last year that officially goes into effect on July 1st of this year. This will meet the mandate to have the 2 hours of training for educators and school staff. We also offer an interactive screening program that's designed for colleges and large businesses. It's an interactive screening tool where an individual takes a survey and then their mental health status is leveled as a 1 to 4. And if anybody's interested in a program like that, we can connect you with Maggie Mortali, who oversees that for our national office. And then we also have our Project 2025 initiative. We have a very bold goal right now to reduce the rate of suicide in the country 20% by the year 2025. And we are working to accomplish that goal by focusing on areas where we feel that we can make the greatest impact. And that is in our healthcare settings, in primary care physician offices, in corrections, and then also through firearms education. But really everything that our organization does right now and everything that we are driving forward helps to achieve this goal of our Project 2025. And finally, we fight suicide and mental health conditions in our state through our advocacy and public policy team. We have field advocates across the country that represent every state. These are individuals who want to use their voice to ask for support for smart legislation that will make a difference. Legislation such as the suicide prevention education programs in the schools, or barriers on bridges, or other legislation that we know would positively impact those who are struggling or maybe in a suicidal crisis. We have actually an advocacy event this Thursday at 1 o'clock. We will be talking about how we advocate and how you can talk to your legislators about topics that are important. But we know that one of the biggest ways that we can make a difference is by having smart laws. So that's a little bit about AFSP, why we do the work we do, how we're getting that work done on a national level. And now I'd like to hand it over to Lisa Riley, our board chair, and really the founding member of our New Hampshire chapter. And I'll hand it over to Lisa.
Thanks, Shamra. You were doing such a good job. I was just sitting back, kind of taking it all in. You're awesome at this. Are you going to be forwarding these slides as we go?
Yep,
or
I will. I'll forward it for you.
I appreciate that, my friend. Ellen, thanks for having us today. I feel like this is a good segue to kind of talk about really what I think is really the most important thing about AFSP, aside from the tremendous investment in research, is really the boots on the ground. I cannot find another organization like AFSP in the model of statewide chapters. As Shamra suggested, there's a chapter, at least one chapter in every state across the country. I have been proud to be part of this organization since 2006 and have watched just the movement on the ground slowly take place in every state, which is just tremendous work. What's really cool about this model is that the volunteers on the ground in these chapters really have a buy-in. We have this opportunity to be part of the organization on the ground, where we have a board of directors, we have volunteers in various parts of what we do, but the board members have an opportunity to help us decide and discern what's our investment locally. So for instance, this bill that has recently been signed into law that really mandates education for students in addition to staff, teachers, administration, we now really have this opportunity to say, on the ground, we're ready to start teaching people in our communities. So now it's personal. When we look at things in a countrywide basis, that doesn't account for us, or that somehow doesn't affect us, but this is us on the ground. So people on the board, people that are field advocates, people that are invested in our organization on the ground here have a say. They have an opportunity to help us decide where the investment is. We've been very proud to be part of this Senate bill passing to law with the mandate. So the slide here shows you really what's happening now as kind of the footprint in New Hampshire related to suicide. Our rates are very high. There was a time in New Hampshire history where the rates were very low. What was happening on a public health level in New Hampshire all those years ago is not happening now, unfortunately. What was happening in terms of catchment and resources all those years ago when New Hampshire's numbers were very low is not happening now. And I believe in my heart that we are moving back towards that we are moving back towards that public health look, where we need to invest. We need to invest in education. We need to invest in resources. We need to invest in our kids. And I really believe that these numbers will improve. As Shamra suggested, with every death, with every loss, there is a fiscal component. And if you come to our virtual advocacy event on Thursday, you'll learn that unfortunately our lawmakers, they do attach a fiscal note to everything. And when someone dies, they can't work, they don't pay taxes. The burden to the community is tremendous. So we do include the financial stuff on these footprints from the states. We don't want to, but the reality is our federal lawmakers, our state lawmakers, they don't really want to or know how to talk to us unless we talk to them in their terms. So that's why you'll see the economic information on this. Sham, go ahead. Every chapter in the country has a board of directors. Every chapter in the country has a staff member. We're so lucky to have Shamra Simpson with us. The role for Shamra as a director is really to do the work of the foundation during the week when all of our board members and volunteers are at work. We are a volunteer-driven organization on the ground. So all of our board, all of our volunteers are working, and Shamra is keeping things organized and organizing our events during the week. It's been really imperative that we have this buy-in from the volunteers on the ground. And like I said, you know, every state has at least one chapter. All of our volunteers, all of our board members have been touched by suicide in some way. Many of us are loss survivors. We've lost a loved one to suicide. Many of us have lived experience. We are struggling with our own mental health issues and doing well. We also are caretakers for those with lived experience. And I think that we do a good job at everybody. All comers are accepted at this table at AFSP. And we are doing our best to connect and collaborate with everybody on the ground in New Hampshire. This is not just us trying to make decisions without interaction. As Shamra said, collaboration is one of the biggest things that we do. If you allow us to work with you, we want to work with you. We have some amazing events in New Hampshire. We have a number of community walks in Portsmouth and Nashua, certainly Concord, and more recent walk in Keene. Campus walks. Again, our goal, to be honest, is not just raise money. We are a fundraising organization, but our real goal is to create this culture. We do that at these fundraising events. People come. They don't even know how to talk about suicide, and they come. They come to training. They want to learn how to help their own communities. And I think we do a really nice job with some of the modeling that we're doing now, where, you know, it's hard for Shamra, it's hard for our 8 board member group, it's hard for our X amount of volunteers to do trainings throughout the state. But the reality is we've got a great model where we'll train you to learn how to train your people. We'll train people to become their own trainers in the community. So a church can do their own trainings once they've received our training. All of the information and resources we give you are free of cost because of our fundraising. But our goal is to cover the state with training, with language, with resources, so people don't feel so isolated when it comes to suicide. So people know what to do, just like people know what to do when there's somebody who might be having a heart attack and CPR is started, or someone's having a stroke and we're looking at the facial droop and the garbled language. There are things that we've been taught through public health channels, and that's really what we want to be a part of here on the ground. Taking action is something that we do as volunteers. From day one, I learned how to talk to someone about suicide safely. I learned how to ask somebody if they were having thoughts of suicide. I learned how to sit in front of a state lawmaker and a federal lawmaker and how to share my story, how to tell about my own loss, about my own struggles. And the reality of it is, isn't that really what this is about, that personal connection? We're trying to encourage our lawmakers to really pass laws that make sense. Yeah, there's investment. Yeah, there's a financial component to these things, but the investment is in our people. We would not be a state without our people, and we won't be a healthy state without healthy people. So we'll continue to encourage advocates to get involved, encourage people to partner with us, encourage people in the community and across the state to take a training, learn how to talk about suicide safely, take a training on how to prevent suicide in your community. Be that one community member in your church who's comfortable asking someone, Are you having thoughts of suicide? We are all about training and with real appropriate tools. Go ahead, Sham, I'll send it back to you.
I do want to mention one more thing on the training that Lisa mentioned, especially for our Talk Saves Lives and our More Than Sad program. I'll say particularly for the More Than Sad program, because it does meet the requirements for the current Senate bill. We do have a model to train individual school districts to be presenters or facilitators of the More Than Sad program. We have actually been working with the Rochester School District. We've trained 16 of their school staff in that district, and then we'll be doing another training for them this summer, where we're equipping the school district with the program and the tools and the resources so that they can offer the training within their own school district at their time frame and within their own availability. And so if that is something that your school district might be interested in, rather than coordinating a schedule with us and coming out once a week or once a month or however often that is, we can provide the resources and program availability for you to be trained as facilitators and to offer that program within your own school district. We are so excited to be able to join Ellen again for the next 4 weeks. Next week, we are going to be sharing resources that we have on mental health and COVID-19. We have the most amazing medical director, Christine Moutier, who has been on with Anderson Cooper and working with other staff in our national office to really develop some fantastic materials and resources available to you. And I'm talking about even recipes and coloring books and things for yourself and that you can share with your students. On May 11th, we'll talk about some of our virtual programs and how you can bring More Than Sad or Talk Saves Lives to your school or community, whether it's your teachers or your parents. On May 18th, we will talk about how reaching out can save lives and share our #RealCombo campaign, as well as our Seize the Awkward campaign. And then I think we'll be back one more time on Memorial Day to just check in with all of you and share some of our techniques and hopefully hear from you on things that you are doing for self-care during this COVID-19 pandemic as well. If you have any questions at all, you can reach us at newhampshire@afsp.org. Oh, looks like there's a typo. Or you can contact me directly at ssimpson@afsp.org. If you email us at either one of these email addresses, we can reach out to you if you have questions about our programs. If you are interested in taking part in our advocacy event on Thursday, please contact us, reach out, and we will get you signed up for anything. We want to thank you so much for joining us today and thank Ellen for having us. You can access additional resources through our COVID-19 website, as well as our chapter website at afsp.org/New Hampshire. And then you can follow us on any of our social media platforms. We have a Facebook page. We're on Twitter, YouTube, everything. And we hope that you will continue to be safe and be well. And we look forward to seeing you again next week. I guess I'll hand it back over to Ellen.
Awesome. Thank you so much. It's not lost on me that you chose green for those May events that you'll be joining us for. I love that. Children's Mental Health Awareness and Mental Health Awareness Month coming up in May. That the ribbon color is that awesome green. So I'm really excited that I'm really thrilled that you guys are going to be joining us every Monday. We'll have to come up with some kind of fun Monday mental health in May, something with an M extravaganza for our afternoon bell sessions. I think that's really wonderful. And we're just so excited that you're partners in this work with us. And we really appreciate you taking the time. We do have a question. Has there been any success with using an interactive screener at the high school level?
You want to take this, Lisa?
Yeah, I'll take this. So there is currently some work being done on using what I would refer to as the ISP, the tool, the ISP at that level. Because there are so many different state laws, school specific things, it's not easy to roll out in that environment. to be honest, this was initially used at universities and colleges, and then we've been kind of tweaking it and have successfully been able to roll it out in organizations, companies, EAPs. So the real answer there is yes, it is being looked at as something that can be implemented within the school system. But that's a bigger beast than using it just at one university, where there is the requirement for ISP is that you have mental health staff, that the university or the college or the EAP, they have their own mental health staff. So schools don't always have that ability. But you know, we are an innovative organization. So I would not be surprised if that would be coming on the horizon. But right now, it is not a tool being easily utilized in a high school setting. Great question.
One of our favorite partners does have a screening tool that's appropriate for that age group. So I would encourage you to go to Connors Klein Foundation, and you may be able to find, I believe they have an online screening that is easy to access right now.
That's excellent. Yeah, we know that those, you know, universal screeners and screeners, you know, mental health or threat assessment screeners are really, they're key to prevention. So it's great that that's, you know, a topic of discussion at the national level, and that there are some existing resources as well.
Yeah.
It's great.
You know, some schools have their own resource person or two, and their own focus is just that. So again, it's a tool that's really, it's very flexible and very malleable. We're as an organization, we haven't rolled it out as such in terms of that cohort specifically.
Great. I think too, even with our educators, you know, if we're talking about faculty and staff, they're equally a vulnerable population where we all are. And so, you know, it could be a tool that's used, you know, at the district level for adults.
Absolutely. I mean, we've rolled this out to, well, Boston Police Department has their own ISP tool. EAPs in New York State are using EAPs are using ISP tool for their cohorts, and it for some big organizations, it's a great idea because it's one of those things where people don't know where to go, they don't know what to do, and yet if it's kind of rolled out that this is what we have and this is what we do, then I think there's buy-in from staff and from employees. So we love it. It's a great tool.
That's awesome. Yeah, I imagine it really is like an education tool too, and it's a conversation starter. If that becomes the, you know, that's part of the culture, that we all care for each other, and we want to provide, you know, resources for people.
Yeah.
And that gives people a sense of the climate and culture of, you know, the organization or the school or whatever.
What's cool about the ISP tool is that it is interactive in that it's not an automated response to however anybody scores on the quiz, you know, whether you can call it a health check quiz or the survey. The response is real time, and it's a real person. That's why you need to have a mental health staff counseling center kind of reviewing some of these responses, and they're tiered based on how worrisome they are. But that engagement wouldn't otherwise happen if someone didn't link on to the tool. So it's absolutely, it's anonymous in that you don't have to pick up the phone, but the engagement is real.
Yeah, excellent. That's great.
Yeah.
I'm wondering if you could just speak to exactly where to go if anybody is really interested in that virtual advocacy training. Is it best to just go to your website, or is there a Facebook event or anything? What do people need to know?
Right now, they should just email me directly. So all the Zoom bombing, that link is very secret. So if you email me at ssimpson@afsp.org, I can get a link to get registered. So it runs from 1 to 2:30 on Thursday afternoon. We'll give a little bit of information about AFSP, some of the same slides that you heard today, but we'll also have our public policy committee or staff from our national office on the phone. We'll teach you how to advocate, why advocacy is so important, how to set up a meeting with your legislator, how to have a conversation and share your story safely with the legislator, and how to really address legislation that will make a difference in your area. your state. So just send me an email and we'll get you signed up right away.
Terrific. That sounds great. I'm going to put that in the chat for those of you tuning in, so you have Shamra's information right there. So thank you so much. This was really wonderful. And as you've mentioned several times, and you have that awesome slide, you'll be back, which is great. So we'll be seeing you every Monday in May. It's really nice to have that consistent little check-in, and we'll start to tease apart all of the wonderful resources and supports that AFSP has, both nationally and at the local level too, which is fantastic. So thank you again so much, Shamra and Lisa, for this overview. And thanks to you tuning in. We'll see you on Facebook Live at 9 a.m. for a morning coffee chat tomorrow, and here on YouTube at 3 p.m. for another afternoon bell session. And for a list of our upcoming live streams, we encourage you to subscribe to our newsletter at nhstudentwellness.org/contact, or by following us on our social media channels at NH Schools on Twitter, or at NH Student Wellness on Facebook. Thanks again, and be well.
We'll see you soon.
Thank you. Have a good day, everybody.
Thank you.